Welcome to Moving Medicine, a podcast by the American Medical Association. Today's episode was recorded live and produced in collaboration with the PermanenteDocs Chat podcast. It features Vice President of Ethics at the AMA, Dr. Audiey Kao. He and Dr. Alex McDonald, the host of PermanenteDocs Chat, talk about the intersection of medical ethics and evidence-based medicine. Here's Dr. McDonald.
Hello, everyone. Welcome to today's PermanenteDocs Chat. I am your host, Alex McDonald. I'm very excited for today's discussion. Today, we're discussing medical ethics with Dr. Audiey Kao of the VP of Ethics for the American Medical Association. So, Dr. Kao, thank you so much for joining us. Tell us, sorry, someone's knocking on my door, interrupting me. So welcome so much for joining us. Thank you for being here.
Well, thank you for having me.
Great. So those of you who are here live or watching from LinkedIn Live, please make sure you submit your questions in the Q&A box. Please get these questions in early. Our chats are often very short and high yield, so make sure you get those questions in. Let's just jump right in here. So Dr. Kao, tell us who you are and what you do.
So I am the VP for Ethics at the American Medical Association, and in that role, I oversee the educational and policy setting activities involving topics in ethics for the AMA. I'm also the editor-in-chief of the AMA Journal of Ethics, which is a peer-reviewed monthly ethics journal that explores topics in medicine and healthcare.
Wonderful. So clearly a lot of experience and knowledge to pull from. So excited for our chat today. So maybe for those who are not as familiar with the field of medical ethics in general, like how would you sort of explain or kind of in some broad strokes explain what medical ethics is and is not?
Yeah, I mean, I think most doctors have heard of this term, the art and science of medicine. And so in general, ethics deals with the non-scientific part of the practice of medicine, of good doctoring. And that draws on, deep histories within the practice of medicine that go back 2,000 years, the Hippocratic Oath. And it's really an expression of the values that comprise what good doctoring is. So compassion, empathy, values of that sort.
Yeah. And when I think of sort of ethics in my mind, I think of sort of doing the right thing for the patient, for the physician, for the healthcare industry in general. And then also the other piece, really trust, because trust is so foundational. Without trust, you don't have that patient-physician relationship. And no matter how much data and science you have, it just doesn't work the same way. So can you tell us how trust is such a critical component to medical ethics?
Yeah, trust is a cornerstone of the therapeutic doctor-patient relationship, because without that, patients are unlikely to share personally sensitive medical information. And sometimes trust is all we have in terms of therapeutics for patients. What I mean by that is that there are times when there's not much the science of medicine can do.
Right.
So just being with the patient, being their companion during their suffering or during the last months and weeks of their life is really emblematic of the art of medicine and the importance of the earned trust that patients have in physicians and the profession as a whole.
Yeah. That brings up sort of a memory for me. I remember I was probably maybe 1 or 2 years out of residency and practice. And I had this patient come in who had this like horrible back pain, and they were seeing specialists in physical medicine and anesthesia and doing epidural injections. They even saw neurosurgery. They're having this horrible back pain. They were on basically all the medications. They were doing physical therapy. And I basically said to them, look, I'm sorry, like you're doing all the right stuff. Like there's really not a whole lot I can do for you right now, but how else can I help? And the patient just sort of looked at me and was like, well, you listened to me and that was worth it. that was worth my copay. Am I coming in for the visit today? And so I think sometimes we get caught in this mindset of we have to do something as physicians, but sometimes we can literally just bear witness and be present with our patients, and that's so powerful.
No, absolutely. And I think this notion of just being present with your patients when there's not much from the scientific side that one can offer them is really challenged, because I think we're all time pressed in our practice. The 10-minute, follow-up visit, the 30-minute new patient visit.
Yeah.
Sometimes it can feel more transactional than
Mm-hmm.
relational.
Mm-hmm.
And I think that that's where we need to keep focus on that dimension of the doctor-patient relationship, I think.
Yeah, I mean, as a family medicine physician and primary care physician, I could not agree more that longitudinal relational based care is just so much more personally fulfilling and professionally fulfilling for me, and I feel like the patients get a lot more out of it. I have had some patients waiting, weeks and weeks to come see me versus seeing somebody, in urgent care or one of my colleagues, because they know me and they trust me, and so I swear that as an honor in many respects too. Well, so let's switch gears a little bit here. So there's sort of a lot written about sort of maybe this perceived tension between sort of ethics and ethical decision making versus sort of evidence-based medicine. And do you think there's sort of a tension between those two, or are those complementary? How should physicians think about the relationship between ethics and evidence?
Yeah. So I think ethical decision making requires that we take into account patients' values and preferences.
Mm-hmm.
And so practicing evidence-based medicine should not and does not preclude taking into account patient values.
Yeah.
So I don't view it as necessarily a tension from that standpoint. I do think that for physicians, one of the challenges in evidence-based medicine um, um, practicing medicine is not cookbook. And what I mean by that is, if it was, anybody could do it.
Right.
And so the challenge of practicing evidence-based medicine is knowing when those protocols or evidence-based approaches
Mm-hmm.
is appropriate for the individual patient in front of you. And more importantly, when it's not, and when you would deviate from evidence-based medicine.
Mm-hmm.
And I think it's important for physicians to be clear about why they are following evidence-based practices, and more importantly, when they are not. Because when you are not, then you have to be clear about why you don't think the current evidence is either valid or applicable to the individual patient in front of you.
Mm-hmm.
You took care of the nation. It's time for the nation to take care of you. The AMA stood by America's physicians and patients during the pandemic, and we're not stopping there. We're fixing prior authorization, leading the charge on Medicare payment reform, supporting telehealth, fighting scope creep, and reducing physician burnout. It's time to rebuild, and the AMA is ready. To learn more about the AMA Recovery Plan for America's Physicians, go to ama-assn.org/time to rebuild.
It's interesting. I think a lot of what we do, especially in primary care, I think is very intuitive. You can't read that in a textbook. You can't look that up online. A lot of it just comes from a lot of experience in terms of I think this SSRI is going to help you. There's no evidence that one SSRI is better than another when it comes to treating depression or anxiety. And sometimes it's sort of just a gut reaction. When I'm working with residents, sometimes they ask me, they're like, well, why'd you pick that one? And I look at them and I say, I don't know. It's just my gut reaction, and we'll try it and see what happens. And no algorithm could do that, I guess.
Yeah, I mean, what you're describing is how, I guess, medicine has been long practice, right? Clinical experience and judgment. right? Whether it's our N of one or N of two, right?
Right.
That we see as physicians. Evidence-based medicine has only been around for about 30, 35 years. And that's well and good, because I think we need strong evidence to support, the recommendations that we make for our patients. But at the same time, it's not cookbook.
Right. Exactly. I agree with you. Well, and that actually leads me perfectly into my next question regarding, AI and medicine, right? So a lot of sort of machine learning and augmented intelligence or artificial intelligence, whatever you want to call it, is really kind of, finding its way into every industry, healthcare no different. And how do you think that using ethical considerations with the rapid evolution of AI and machine learning is going to impact medicine?
Yeah, I mean, I think if I could, I'm tempted to, in real time ask ChatGPT the answer to your question right now, but obviously I can't. I can't, but I raised that maybe starting just to think about how AI is going to impact the doctor-patient relationship. And from the patient side, as more of these AI chatbots get developed, doctors are going to confront a higher level of where patients bring in their ChatGPT response to some question, right? All of us who've been in practice during the internet age all know the reams of printed out websites that patients bring to us.
Yep.
And that's probably going to happen to a very greater degree going forward. And as chatbots get smarter, again, our role as doctors, as kind of like the learned professional, is how to help patients sort through all that evidence or non-evidence that we get. So I think that is maybe oftentimes not thought about currently in the AI debate, but it's something that we all experience currently.
Yeah.
But
sorry, go ahead.
Go ahead.
No, I was going to say, I sort of describe myself to patients as sort of the interpreter, right? You can read till you're blue in the face, but I can then take that data, interpret it, and see how it applies to you as an individual, and then have that shared decision-making about what treatment is best.
Right. And then your larger question about its other impacts. I mean, I think for all of us as physicians, most of us are not going to be involved in the development of AI tools.
Right.
Most of us probably aren't even going to be the ones who are going to purchase and deploy the AI tools in our hospitals and practices. And that raises, I think, a lot of important considerations, because we're not the developers, nor are we the deployers of these AI tools. So having transparency, what I mean by that is, as frontline clinicians and frontline physicians, AI tools can be a black box, right? Like, how can this AI tool be a valid and useful clinical decision support system, right? And if you were to ask many developers of AI, they may not even be able to answer how chatbots come up with their answers to questions posed. And that's both revealing in terms of what we as physicians need to hold developers and deployers of AI accountable for, in terms of knowing how algorithms arrive at their decisions, which gets back to your earlier questions about evidence-based, right? What kind of evidence base do they draw on with these algorithms to arrive at decision support recommendations for physicians? So I think that's a really important point that needs to be addressed before these AI tools are widely deployed.
Yeah, I completely agree with you. And I think the other piece too is, you're right. The vast majority of physicians are not going to be involved in the implementation or development of these tools. But I think it's absolutely critical that we do have some physician input as we develop these tools, because, I can use the example of the electronic medical record, 15 years ago, let's be honest, physicians were not really involved in creating those systems, and now they're not very user friendly for the physician. They're not very user friendly for the patient. And so just as if I can get on my soapbox for a moment, I really think it's critical that physicians and the physician perspective is on the ground floor as we continue to develop these AI tools, because they're here whether we like it or not. We're going to have to contend with them. So we might as well be at the table as we continue to develop these tools. But that's a bit of a segue.
Yeah, no, I couldn't agree with you more. I mean, I think that as the group that's going to take the recommendations from, a ChatGPT like tool, it's important for us to, be involved in the development of it as best we can. But as I say, most physicians are not going to have a role in that. And so it's important for the practicing physician to understand basics about how these algorithms work before they can rely on them, I think.
Yeah, that's very true. And AI is such a huge topic. We've done a couple other chats about that. So for those of you listening, shout out, go look at some of our past podcasts regarding AI, and I'm sure we'll do more in the future as those come up. So make sure you get your questions in if you have any questions. We have just a few minutes left here. One thing that's always interesting to me is sort of using ethics and using ethical medicine, but also then you're balancing that with patient safety and patient autonomy, and physician and clinician well-being and mental health. Do you have any sort of protocols or ideas regarding kind of balancing sort of ethics with patient safety with physician wellness?
Yeah. How much time do we have?
You're right, exactly.
So maybe I can take it to the most extreme example. I mean,
Sure.
all of us have been either directly or indirectly involved in situations where a patient is threatening or potentially threatening himself or the safety of doctors and the healthcare team. And that's a true ethical conundrum for physicians whose goal is to provide compassionate care. And what I mean by that is when patients are, let's say, so severely agitated that they're threatening themselves and the physical safety of physicians and the healthcare team. How do you go about applying what I call force compassionately? That may sound like an oxymoron, like compassionate force, but it's actually, critically important to maintain the relationship with the patient. And I would offer a couple of thoughts, is that as physicians and as leaders of healthcare teams during those situations, how we talk with the patient and with the healthcare team in trying to de-escalate those situations is critical.
Yeah.
And what I mean by that is the language we use, capturing the situation of the quote unquote aggressive or disruptive patient only serves to escalate the situation, and describing the situation as a patient who may be frightened or frustrated or is having unmet needs seems pretty obvious, but in that moment, it's probably the most important kind of reset a physician can engage in during those situations.
Yeah. No, that's definitely an extreme example, and I think it's important to make sure that I sort of think of the analogy of the airline mask. You got to put your own air mask on first before you help somebody else, and I think we need to make sure that we are not compromising our own values or our own safety in an effort to provide sort of real, ethical medicine for our patients. And so I think that's a great example, albeit an extreme one, but I think it certainly highlights some important points. So we have a couple questions in the chat here that I want to get to. So
Sure.
One question here, is there a medical ethical question that you really struggled with as a medical student or a resident or early in your career that now with experience you sort of found an answer and can share that advice with those who are newer in practice?
So as a student, one of the challenges is that what do you do when you observe unethical behavior
Yep.
among your peers, and then more difficult with people who are more senior to you? And I think that is difficult for any student to navigate. And I think as you progress in your career, I mean, all of us are part of a profession, so we self-regulate.
Yep.
And how we deal with unethical or incompetent colleagues is a real challenge, right?
Absolutely.
And but it's something that we need to do.
Mm-hmm.
And I think that how one goes about honoring that responsibility of self-regulation and policing thyself is not easy. And my only practical tip, is that it's important to kind of engage that potential person before kind of taking it to the next level. I think that's critically important.
Yeah, no, I think that's a great example. And I think for me, when I see colleagues who are maybe not practicing what I consider maybe up to what I would want our standards to be here in our practice, is I just talk to them, and I come to them as from a point of caring, right? Not ridiculing them or telling them they did something wrong, but being like, hey, I really care about you as a physician. I care about our patients. I care about our practice. How can I help? And being sort of appreciative in the inquiry, that's something that I found useful, and people are much more receptive to than sort of saying, hey, you did this wrong. Like, let's be honest, we're all a little type A. We all want to be perfect. And it's hard to have those conversations, but ultimately those conversations are going to make us all better, and something that I aspire to in my practice.
Curated from more than 3,000 major newspapers, magazines, and journals, the AMA Morning Rounds newsletter delivers the top stories in healthcare right to your inbox, Monday through Friday. Subscribe today and check out all the AMA's free newsletters at ama-assn.org/myinbox. That's ama-assn.org/myinbox.
Great. Well, this has been phenomenal. I have one last question, and it's my favorite question, and one that people kind of struggle with the most. What makes you most proud to be a physician?
Well, I've always felt it's a privilege that strangers allow us into their lives in such deep and meaningful ways. And so I've held on to that ethic, if you want to call it, in my 35 plus years of being a doctor. So I think that's why I'm proud to be a physician.
Wonderful. And for those listening who want to learn more about medical ethics, where do you recommend they learn more or find more information?
So I mentioned at the outset, I'm the editor of the AMA Journal of Ethics, so a little self-promotion here. It's an open access journal, so our URL is journalofethics.org. I would also have people go to the AMA Code of Medical Ethics, which provides a valuable resource for guidance, and that URL is amaethicscode.org.
Great. Well, thank you so much, Dr. Kao, for your time. We really appreciate you joining us and sharing your expertise.
My pleasure.
Subscribe to the PermanenteDocs Chat podcast to never miss an episode and register to take part in upcoming live chats. Visit permanente.org/AMA Docs Chat.